Here are 2 easy ways you can care for your loved one, specifically about mouth care and skin care. So a big concern that I see a lot at the end of someone's life is mouth care. They will typically be mouth breathing. As I've told you in other videos, towards the end of people's lives, it takes muscles to keep your mouth shut. So a lot of times people's mouths will just hang open and they end up mouth breathing. When they mouth breathe, that's okay, right? But it just makes their mouth really, really dry and their tongue really, really dry. If people can still drink and take in water, good. Great, especially if they're asking for it. You can always just give them water to help moisten their mouth. But if they can't do that anymore, we want to make sure we provide them with really good oral care. So what does that mean? The hospice company will usually provide some kind of sponge on a stick, which I will show you here in this picture. These happen to be pink. Some facilities are pink, some sponges are green, blue. It doesn't matter the color of the sponge. Just know that these are for oral care and moistening your loved one's mouth. Now, I want to be clear. This is not you trying to get them to drink water. However, they could technically suck on the sponge too and drink water, but that's not what this is for. This is for to moisten your loved one's tongue, their inner mouth, so they don't feel like they have a dry mouth, because dry mouth can feel really uncomfortable. Another tip would be when you're doing this to make sure their head of the bed is up, at least above 60 degrees, just to prevent any kind of aspiration if they do end up getting some water in their mouth. Even if your loved one has the terminal secretions or the death rattle, I still would utilize these sponges, one, to make sure their tongues are moist, their gums are moist, their teeth are a little fresh. If you can get the terminal secretions, sometimes people even use the sponge to circle around their loved one's mouth, and some secretions can come out. You could also utilize ice chips if your loved one is a little more awake and can suck on ice chips. That's a great way to moisten their mouth. Or popsicles if they're a little more awake, that can help moisten their mouth and give them some flavor. Even on the sponges, you don't have to use ice water. I always say use ice water, but if you know your loved one loves apple juice, grape juice, whiskey, I've definitely seen people put whiskey on these sponges and put it on their tongue and gums. The whole point is to just keep your loved one's mouth moist. Many followers of mine write in telling me that they were concerned because their loved one had a black tongue at the end of their life. I want to clear something up about this. So this doesn't always happen to everyone who's at the end of their life, but it is a condition that does happen. It is harmless. However, it does look really bad and make people concerned. So what is it? This typically is because there's a buildup of a protein called keratin that develops on the surface of the tongue, but sometimes it is because of bacteria or fungus that is building up on the surface of the tongue. Either way, please know that it is harmless. There is not much we can do about it at that time. However, it should clear up on its own, and you still want to do the same thing I've been telling you to do, which is just to keep the tongue moist, keep the mouth moist, usually using those sponges you can get from the hospice company. What matters most is that you're with your loved one. These are just tips and tricks that I like to give you so you know what to do and how to do certain things to comfort your loved one at the end of life. At the end of the day, what's important is that you are there for them and that you're there witnessing their end of life process. The other topic that is important is maintaining your loved one's skin integrity. So what does that mean and how can you do that? People on hospice or on palliative care, anyone debilitated basically, anyone who has a difficult time just getting out of bed and caring for themselves, are going to be at risk to developing skin wounds or pressure sores. They can be called all different types of things, but in general, their skin is at risk for breakdown. So as a caregiver, how can you help with those things? First thing I want to say is sometimes you can do all of the best things, all of the right things, and your loved one will still get skin breakdown just because the skin is an organ, and if the body is shutting down, so is the skin. Sometimes if a person is malnutrition, which they will be at the end of life, you can do everything right and they still will get pressure sores. So please be easy on yourself. But here are some tips on how to prevent those things from happening. Number one is keep them dry. I know this is impossible at all times, but if someone is bedbound and incontinent, you have to frequently check to see if they are dry or if they have soiled their brief, so urine or stool. So at the start of the day, first thing in the morning, you definitely want to check to make sure if they're wet or dry. They'll likely be wet, so you want to make sure you change them right away because dry skin is best. Moist skin is where skin can start breaking down. It's possible when you're changing them and they're on their side, you want to look at their whole entire back, because there are pressure points all along the backside that will stick out and be more at risk for breakdown. And you want to look for discoloration of the skin, Does it look black? Does it look pink, red, white? Anything that's discolored you want to look at and take note of. The main places I see this is at the tailbone, on the heels, shoulder blades, elbows, different parts of the back and the butt as well. But anywhere that's like prominently sticking out, especially if someone has lost a lot of weight, they will have bones that are sticking out on their back, and those spots will likely be discolored. So take note of those spots. So what do you do once you see those spots? And I'm gonna show some pictures of what they may look like. It's usually like a pinker area of the skin. When you notice that, you just wanna take note and make sure when you're doing your baths, you're washing everywhere, putting lotion everywhere. A lot of times circulation will really help. So if you're rubbing that area, that can help. But the biggest thing you can do is taking off pressure relief. So frequent turns. I know when I worked in the ICU, we were told to turn someone every 2 hours. Now, if someone's at home on hospice, that's not something I want the family to hyper focus on, because the whole point is just the overall care. So it's not like every 2 hours you have to turn your loved one, but it is just something to note. It can be as simple as a pillow placed under one of the buttocks, just to place a little pressure off that side. And then in a few hours, when you think of it again, you pull that pillow out and lay them flat. Have them be flat for a couple hours. Then put the pillow on the other side. It can be that easy. You can place pillows underneath their arms. I love floating people's heels. I'll put a picture of it right here, where you just place a thicker pillow underneath their ankles so their heels are resting off the bed. That is the best way to prevent any kind of breakdown on someone's heels, which is very typical for someone who is bedbound. Let's say you're turned your loved one or you're changing your loved one and you notice that one red spot that was on the tailbone 2 days ago that was not open, the skin was intact, now looks a little open or is a little cracked. That officially makes it a stage 2 wound. Now, when someone has a stage 2 wound that's a little more advanced, and you definitely want to talk to your hospice company, let them know. There could be wound orders that need to be placed by the doctor. The nurse might want to come and change that wound to make sure we can get it closed, and then eventually teach you how to do it as well. Again, like I said, you can be caring for your loved one the best you possibly can, and that can still happen, because sometimes it just does, because of malnutrition, because of the disease process, like I said. So don't be too hard on yourself, and we'll do our best as a hospice team to get that closed. But also know that at the end of the day on hospice, the main thing about wound care is keeping the wound infection-free, not necessarily healing. Because sometimes we know that no matter what we do, it won't heal because of malnutrition in the disease process. It just depends. And remember, it's not all about the individual things you have to do. The overall thing is just being there for your loved one. Are they clean? Are they safe? Are they comfortable? These videos are just tools for you to use to be there for your loved one.